It's loading. Here we are. We are live with, I'm going to say, Dr. Rowe and Dr. Christopher Estes. But from here on forward, they prefer to just be called Emily and Chris. And I should remove the doctor from my name as well. But so I'm Bo. We got Chris and Emily there. And they are joining us from Miami Beach Comprehensive Wellness Center.
Yes.
Yes. And Emily, I've known for, almost a decade. Back, I used to travel a bit to Miami, and we connected through, I believe, Megan May was the primary connection there. And yeah, I used to travel to Miami quite a few times, and especially working with the company that took me out to Dubai. And sorry if I turn a little bit. My dog's always trying to play ball with me here. But yeah, we connected back then, and she did some, definitely did some acupuncture sessions back then. And would love to dive into some of those aspects of healing and where our practices have gone in those years. But that's our background. I'll let you guys kind of catch us up on what's going on in Miami and tell us a little about yourselves.
So I practiced acupuncture out of my house for years. And then I actually lost my house and didn't have a place to practice anymore. And at the time, I was having very complicated health issues. And even though I trained in conventional medicine and also Chinese medicine, I was at a point where nothing was really working. And so that's when I decided to go back to school and learn more. And I learned about functional medicine and took a deeper dive into how environmental toxins affect our health, things like heavy metals, mold toxicity. And I also became an expert in Lyme and the other tick-borne co-infections by working with Dr. Horowitz. And Chris and I opened up the Miami Beach Comprehensive Wellness Center in 2017.
2017.
Yeah, and we've been doing this since 2017. And I integrate a variety of modalities depending on what a patient needs.
Awesome. And Chris, give us a little, I know you're a board certified OBGYN.
Yeah, I that was my original training, was OBGYN, and I was in the world of conventional medicine and academic centers and tertiary care referral centers and in all levels of administration and education and stuff like that with residents and medical students. And I just got increasingly frustrated with people's lack of progress, particularly my very medically complicated patients. And then through our own personal experiences, we started learning about things like environmentally acquired illnesses like heavy metals and mold and mycotoxins and Lyme disease and related infections. And, we started pulling that into our practices. And, now we use a true fusion of Eastern and Western approaches in our office. In particular, I do quite a bit of sound healing with a system called Acutonics, which is a system of sound healing that also is based upon principles of Chinese medicine. So yeah, that's where we are now, and actually getting ready to move to a bigger, better office very, very soon. So we got a lot of exciting stuff going on.
Awesome. And you got a shout out from Wendy White.
Hi, Wendy.
She's a lovely client and friend.
Yeah, awesome. And she just said, yay, Emily and Chris. A lot of hugs and kisses. Awesome. Thank you guys for that intro. And again, you as I usually do here, it's called Bono Stuff. Is my podcast, and I'd like to learn more stuff and touch base on a lot of these different topics and things. So let's dive over to that concept of acupuncture real quick, where Emily, you and I go way back. And I'd love to. I'm relatively new to dry needling, and so I'd love to kind of compare and contrast a little bit of how those worlds kind of overlap and what we can talk about there. So tell me a little bit about your background about acupuncture, how you integrate it into your practice, and maybe what your take on dry needling is.
Sure. Well, I went to acupuncture school in, I started in New York City in 2005, and I was working in internal medicine, and I was just, I actually quit working as a physician when I was on my ICU rotation. I saw so much medical futility and just torture and stuff like that. And at the time, I was having a variety of health problems, which were later diagnosed as autoimmune disease several years later. And I went to an acupuncturist out of desperation, and it helped me more than anything I learned in medical school with, the variety of health stuff that I was going through. And, conventional medicine is great if you're having a heart attack, if you need, like, if your spleen ruptures in an accident, but for chronic medical conditions where you just slowly degenerate, I find that it fails a lot of people. And acupuncture was super helpful for me. It decreased my pain, helped me with migraines, helped me with, sleep, regulation of just everything in the body. And so I quit and I went back to school, and I have a 4-year degree in acupuncture and Chinese herbs. So I personally have never studied dry needling. I've seen it done, but I don't have training in it. So it's hard for me to compare. But, I know that dry needling helps a lot of my clients. I treat a lot of professional athletes through this place called DBC down here in Miami. And a lot of the athletes come in to see me, and they've had dry needling, and then they've also had acupuncture. And I think there's a place for both. Acupuncture is based off of energy channels that run in the fascia, whereas dry needling is more like trigger point therapy, is my understanding. But a lot of the acupuncture points are actually trigger points. So I think they cross over way more than people realize. And, some acupuncturists really feel threatened by, physical therapists learning how to dry needle. And I think that's stupid. Any modality that can help a patient should be taught to as many people as want to learn it. And I never feel threatened by another person learning something. Yeah. So, and I mean, there's debates with the licensure right now, and I think it's just silly, honestly.
Yeah. I mean, I practiced previously in New York, where you and I also connected, and I know you had some of your training, and I know I've seen some of your instructors, I think, when you weren't available there, to get some acupuncture when I had a little low back pain going on from some CrossFit I did. And so New York and California were the last 2 states I lived in. Physical therapists are not allowed to dry needle because of that acupuncture kind of political nonsense. And actually moving here to Colorado about a year ago, I got certified. And in our certification, the instructor, he was a military guy, so he moved around, but he actually was in Florida when they opened up the Practice Act for physical therapists and allowed dry needling in for physical therapists to do that. But they talked a lot about the acupuncturists who came in and which ones actually spoke up, spoke down, whatever it is. And so, yeah, there was a lot of scarcity mindset for sure. And it's
no shortage. Yeah. And there's no shortage of pain in the world.
Right.
Something is stupid. And anybody I know who's good has a waiting list. So I don't know.
Yeah. But I mean, I wanted to touch base on the fact that I don't see it necessarily as a trigger point release per se. And the way they taught it to us too. And I took my certification through the American Academy of Manual Therapists, which I think they're one of the best, most evidence-based organizations out there, as I was investigating how to do it. So they still teach the points as like liver 7 and gallbladder 6, and they do teach those points. But they're now, it's still for like flexor tendonitis, kind of thing. So you have to kind of put the pieces together. I haven't bothered to memorize. I'm probably very wrong on which 2 points those were. Yeah, shaking your head. Yes,
it's okay. But yeah, he said, I'm not trained in dry needling.
Right.
You haven't been to acupuncture school. Can we both help people? Most
right. Well, I just want to point out the fact that, again, they're teaching it to say there is something between the things, and we want to acknowledge where this is all coming from. And again, is there something like my understanding is most of the research that's done, and again, there's a lot of flaws in research, doesn't necessarily support acupuncture as the best method. Now, does that mean it has no place? Obviously not. And so is dry needling another form and a slight tweak to it? I don't know. So the way and they presented the 3 ways that, the needle going into the body is useful. The one I always go with, and I explain to my patients and clients, is it's a neuromuscular junction reset. So that's not the same as a trigger point to me. To me, it's saying, you might have some pain through here, and I'm trying to put it in through the levator scap or the upper trap, and I'm just trying to kind of reset that. And one of the big things for me is, as soon as we're done and I take those needles out, now I'm trying to get and do some kind of neuromuscular re-education, as we would call it in physical therapy. So that's where I think, again, some of these worlds can come together. And
yeah, for sure. And I recently got published in a book on energetic medicine. And I wrote the chapter on acupuncture, and I feel honored that Dr. Neil Nathan, who's one of my mentors, asked me to contribute to his book. But the main mechanism where I describe how acupuncture work is via the piezoelectric effect. And you know, your collagen has a crystalline structure, and the piezoelectric effect basically means that when you press on something and you induce mechanical pressure, you have a conformational change, and that conformational change leads to a flow of electrons. And whenever you have a flow of electrons, that's the definition of electricity. And wherever you have electricity, you have electromagnetic fields, magnetic fields that get generated. And so that's how you can get systemic results on the body. Like, why do you put a needle in the forearm and it affects the large intestine? And it's because of those fascial planes and that piezoelectric connection. So, you know, I do treat pain, but I use acupuncture for a lot of stuff other than pain. Like, you know, regulation of heart rate, high blood pressure, just any kind of homeostatic process in the body.
Yeah, I love that. And that kind of takes us to the next topic I wanted to get to. And I love this quote you had in your kind of bio you sent over, is that you specialize in treating patients who have exhausted or failed Western medical therapies for chronic conditions. And I end up describing myself the same way, because I consider myself way out of the traditional physical therapy model.
Oh, you definitely are.
And that's the nicest thing you could ever say to me. I appreciate that. But I'm a huge fan of functional medicine in that term. And again, just to finish that thought is I always say, like, I end up and people buy into my kind of, again, alternative method when they failed with chiropractors, with again, acupuncturists, you know, orthopedic surgeons who want to either do surgery or injecting. So that's where I provide a lot more holistic thing. And I say, hey, invest this much money in me, and we're going to do this for the next 3 to 6 months. And like, that's the system. So it takes a lot more for people to get to that point, right? If they're just normal, healthy people, they tend not to be, or they've just, again, had that a little bit here, a little bit of surgery there, whatever. They tend not to buy in. So functional medicine to me is something I very much rely on. I had a previous functional medicine practitioner who was a nurse practitioner in California. Dr. Pam, I believe, is in the 40s of my episodes. I think this is episode 75 for anyone following along. I don't even.
Amazing how it adds up.
Yeah, might be 77. I don't know. But anyway, Pam is someone who, you know, I'd love to even get like a, you know, I don't know how many other functional medicine practitioners you guys touch base with and things like that. But I just love those topics, those concepts. And again, like you're saying, pushing the envelope. So I'd love for you to, you know, catch anyone up on how you define functional medicine and what that looks like and how that's different than, again, most Western.
I'm going to let Chris take that question.
So, you know, for me, you know, this concept of functional medicine really comes down to looking at the source cause of a person's problems. One thing I often tell patients is I care less about your ICD-10 code than how you got there. So, like, you know, for those of you who maybe don't know what ICD-10 code is, that's like your diagnosis. So you've got rheumatoid arthritis, you've got, you know,
irritable bowel syndrome.
Oh God, that's one of my favorites, by the way. There's a reason why BS is IBS. Like, there's a reason for that, because.
Well, anytime I see syndrome or condition, especially in that ICD code, that tells us it's like, we don't really know what to do with this. And we're going to call it a syndrome because it's a bunch of, even low back pain, you know, non-specific low back pain. That's my favorite from the musculoskeletal side is, what do you mean non-specific low back pain? Like, you know, and again, that doesn't mean we have to say, oh, it's a disc that's herniated and that's the thing. And now if we cut that out, we'll solve everything, right? So yeah, it's the root cause. Do you like the common analogy that I hear put out there about functional medicine is, again, you have pain in your foot and traditional medicine says, here's a pill for that. They might even do an x-ray and things like that. But functional medicine says, why don't we look in the shoe? Oh, there's a pebble in here. Let's remove the pebble and whatever that thing is. So that's the one I hear often.
Chris has an even better analogy.
Which one?
The Sid Baker one.
Oh, Sidney Baker. Yeah, Dr. Baker is kind of the grandfather. He has the tack analogy. He's like, you know, if you're sitting on 2 tacks and I take out 1 tack, you don't feel 50% better. Because you're still sitting on a tack, you know. And if I give you a Tylenol for that tack, you might feel better for a little bit, but you know it's going to come right back because you're still sitting on a tack. So you got to take that tack out too. And the fact is, most people are sitting on 10 or 12 tacks. It's never just 1 or 2 things. So when we do functional medicine workups, we're often ordering like a lot of labs. and a lot of stuff that people have never done. And, looking at microbiome, looking at genetics, looking at toxin levels, looking at chronic infections and stuff like that. I always tell people, look, I never come up empty. I'm always going to find something, because,
the modern world.
Little secret, everybody's got a little something that they can do better. Like, there's always going to be something we can find that we can do a little bit better and maybe address somehow. So, I usually, especially folks who come in with serious chronic medical issues, whether it's something like an autoimmune disease or an inflammatory bowel problem or cancer, we're going to find 8 or 10 somethings that we have to fix. And I also, it depends on the patient, but each of those somethings may be a different size slice of the pie. So it might be a small contributing factor or a very large one. Like for some people, just figuring out their food allergy and sensitivity, like that's like half their problem. Like literally, like they cut out all the food allergy and sensitivity they have, and they're literally they're almost completely on the road to wellness. Whereas somebody does it and they're like, well, I got a little something out of that, but not much. And that's okay. That's just the way it works. And so it's also a work in progress. Functional medicine is a lot about like, well, where are you at now?
Well, and that's where it really overlays with Chinese medicine. In Chinese medicine, both the practitioner and the patient have a disharmony, and everybody has a disharmony. And when they actually created functional medicine, they looked at Chinese medicine and tried to create a very similar structure when they created like the matrix, and the way there's the they have like certain terminology like antecedents and triggers and mediators and perpetuators, and all of this was based off of patterns in traditional Chinese medicine. So it's very interesting how they mesh so well together.
Yeah, that's always fun. And the other thing I always talk about with my experience around functional medicine is, again, the comparison to Western medicine is you go and you get your blood work done, and they're like, oh, everything looks like it's in normal range. And again, my wife has expressed, she's told some of these stories, so I don't think she'll mind sharing that. But yeah, she's like, something is wrong. She's gone to, 7 different clinicians back when we lived in Dubai. That's a whole nother conversation about the medical system there. But yeah, you're within normal limits. You're in that normal range. And again, when you think about the 100 people who might have been used for that normal range, or however many people, it's like, I don't really want to be in that range. But again, that's that subclinical thing where with her specifically, they were able to detect a very precursor to an autoimmune condition, to say it's not getting to your thyroid yet, but it's Hashimoto's. I'm sure you could talk for a while on that if you want to, but
all the time.
Yeah. And the big thing there is like, hey, because we see these precursors and this kind of pattern, you should probably avoid gluten. And like, we know that Hashimoto's and gluten are like cancer and sugar, and it's going to these are things that are feeding off each other. So it's probably best to avoid gluten. And that's the thing that most traditional medicine is not going to find.
Yeah, most traditional medicine they'll tell you to keep coming back to check your levels every year until you need Synthroid. And then you need Synthroid. Oh, good. Now you need Synthroid. Now you got to come back and get your Synthroid all the time. So like, rather than say, well, are you on this path? Is the train heading towards that? It's like, okay, can we reroute it? Like, and the answer is a lot of times, yes. A lot of these things we find are reversible, and highly treatable. A lot of it though comes down to the patient, the individual person's willingness to go ahead with the program too. So another thing I always encourage all of people that see me, when they come back and they've done well, they feel better, they feel great, they're doing better, their labs improve, they always they're like, thank you so much, you guys helped us so much, you and Emily are like working miracles. I'm like, well, look, if you didn't do the work that we suggested you do at home, none of this would work. Because I don't have one misconception I find about functional medicine is like, I don't have a magic bottle of vitamins. Like, there's no magic bottle of vitamins for you. Like, I will use vitamins and supplements, and we use herbs, and of course I prescribe drugs.
You need to drink one of these every day. That's it. That's
exactly. This magical.
Yeah, that's a water.
Because it came out of a very special filter I have sitting over there, and this is the key
It's a triple ionic.
Exactly. It's alkaline.
Depolarized.
You know, it's perfect. You know.
Yeah.
But
or even exercise. There's no pill that
Nope.
replaces that. There's
Nothing
no pill that replaces getting a good night's sleep,
rest.
managing stress, and I mean those are lifestyle things that you have to cultivate.
Have to cultivate. I think is the most appropriate word. You have to do it every day. You know.
And I'll bring up my wife again, and again, I don't think she minds. If she does, I'm gonna catch it later, so it's fine. But the big thing for her was, wake up 30 minutes earlier every day. Make sure you go to bed a little bit earlier, so you're not really affecting your sleep. But you need to get the cortisol rhythms back into kind of sync, and so start out with 10 minutes of light jogging or some kind of movement, a little breath work, meditation. And that's going to set your cortisol rhythm up for the rest of the day. Again, this is the level of testing for those not familiar that we're talking about that again. And again, it's not, here's a pill to, improve your cortisol. It's like, you need to get in sync with nature and like the flow of the sun and things like that, which to some people sound crazy.
And Chris had that issue because, he worked OBGYN labor for years. And so his circadian rhythm was wonkadoodle. And his, like when we tested his DHEA, it was shot. His adrenals were just in the toilet,
roasted from years of less excessive, overnights and poor sleep. And, I had probably a few too many drinks. There were probably a couple too many drinks in there. So like, all that good stuff, catches up with you. And it's all a part of it. I mean, I'm gonna recommend some adaptogens to those folks too, and depending on your pattern, depending on what's going on, some adaptogens, some adrenal extract. But we're also going to talk to you about, hey, what are you doing for stress management? What are you doing with your sleep? What are you doing with all these sort of things? And also the other sleep's a big one. And there's also no magic supplement for sleep. It's like, oh, should I take the theanine? Should I take the
melatonin and
melatonin? Should I take, CBD, and these are, I just named off all things that I use. Like I utilize them in our practice. We utilize them all the time. But I always look at all these things as a bit of a bridge. So, like it's going to be there, especially for something like sleep or something like that. It's like, okay, you don't want to be on this. You'd rather not have to need this forever. So like,
and it's different for each individual, as you were saying.
And sometimes you need it for a little bit. And then
we'll do neurotransmitter testing on people, and they're like, "Oh, I can't sleep," and then they're taking melatonin, and their melatonin's off the chart. I'm like, "This is the wrong supplement for you."
Yeah, and I'm sure you guys could speak more to this, but I know for melatonin, the generally recommended dosage is probably a lot smaller than if you go to any CVS or Walgreens pharmacy. Like you're gonna get almost 5 grams, like some ridiculous dose. That's way more than any human should probably take. Yeah. And that's why it works. It knocks you right out if you're on a flight or something like that. But for what people probably should be starting with, if they're going to even include melatonin, from everything I've seen, they should be taking much smaller doses.
It's the wrong supplement for a lot of people.
For a lot of
people.
Yeah.
I mean, it's got some neuroprotective effects that are very interesting for people with like
chronic viral stuff. It can really help, and mold toxicity as well.
Early memory disorders, like with early dementias, and like if you catch them in the early phases, that seems to be helpful for some people if they tolerate it.
Right, but less so for sleep disruption. Period. Right, like that's the thing where people. It's probably the most popular sleep supplement.
It is.
You know what I like it best for is like jet lag. It works. It works like a charm for that. And we've got a little combination supplement we buy, proprietary thing that's got a nice big dose of mag, a good dose of melatonin, some theanine, and what else is in that one? I don't know. Anyway, it comes in a little drink and you pop the shot, and like it's great after a flight. But taking one of those every night for the rest of your life to fix your sleep is not.
Right. Yeah. And that's always we say skills over pills. So there's breathing, these basic lifestyle things that you should be doing to avoid taking pills. But that is another thing I wanted to talk about earlier when we were talking about early detection of things, and I want to really get to the chronic stealth infections with Emily. That and I love that the title, chronic stealth, is really good. But the two things that it reminded me of. Are you guys familiar with David Sinclair, Dr. David Sinclair? He wrote a book called Lifespan, Why We Age and Why We Don't Have to. I would say he's probably the foremost leading kind of voice on aging. I won't call it anti-aging. I won't call it biohacking or whatever. But he's a really interesting guy. He just started his podcast as well. but he actually started taking a statin in his like 20s because he has a huge history of heart disease and things like that. And he basically said a little bit, you reminded me, Chris, earlier, he basically said, like, do you have to wait for me to get a heart attack before you put me on a statin? Because, you know, he was like, and again, I'm not a huge fan of statins from the side effects and things like that, but he's well informed enough that I think he's balancing out. He's taking a lot of metformin based on, again, proactively kind of enhancing his life. You know, he sounds like he's very confident he's going to live to be 120. You know, and be pretty active and things like that. So, and that's kind of his push. The book was very interesting. But then we also hear about like Angelina Jolie did the genetic testing, right? And she had the precursors for breast cancer. So she had her double mastectomy. So things like that, where again, are these extremes, or are we going to find a nice balance of, hey, like there are ways that we can now detect these things and have a nuanced conversation. And again, have this higher level, not just saving your life medicine, but let's actually like make sure you avoid, you know, these chronic conditions that are probably going to decrease your quality of life day to day. So I'm going to throw it over to Emily about the chronic stealth infections. And again, that's a huge thing that goes very undetected, especially in traditional medicine. And I'll let you kind of rock and roll with that.
Sure. So one of the key turning points in my own health was being diagnosed with chronic Lyme. And it was a chief driving force in all the autoimmune processes I was undergoing. And we were actually at a yoga retreat up in Massachusetts at Kripalu, and Chris picked up this book at the bookstore called Why Can't I Get Better? And, you know, Kripalu is up in Western Massachusetts, right on the border of New York State. And there's a ton of Lyme in that area. So it's more understood and appreciated there. But they basically have this questionnaire that has been tested and verified, I think, and it's basically a list of all the symptoms of Lyme disease. And if you're like higher than 46, it's like 85% chance that you have Lyme or another tick-borne infection. So I really sat down, took the quiz, and I scored 120. And I was like, WTF, I need to like find out more about this. And it explained everything. The chief things that go on with it is chronic fatigue, migratory joint pain. So 1 week it's your back, another week your wrist gets tendonitis, then that gets better. Then next thing you know, your ankle will seem like it's twisted, but there was no trauma, or you'll develop debilitating neck spasms. And it goes in a cyclical fashion because the parasites are on cycles of life. So often, it depending on which specific parasite is in you, it'll be like a 3-week cyclical thing. Women often get flares with menstrual stuff because hormones can affect it. So once I read this book and I started testing with a boutique lab company, because the regular tests that you would run at a conventional lab misses over 50% of cases. So I became versed in this, and I actually went and studied. Chris and I were in the second class that Dr. Horowitz, he trains like 40 doctors a year.
He's the one who wrote the book.
He's the one who wrote the book. And he's, in my opinion, one of the #1 Lyme experts in the country. So we went up to Poughkeepsie and we trained with him. And yeah, it's been quite a journey, and it's very interesting. And a lot of these patients end up coming for acupuncture because they're in chronic pain. And, you know, they've been dismissed by their doctors. They've had all the tests done and says, oh, nothing's wrong with you. It's psychosomatic. It's in your head. And so a lot of my clients actually have a type of trauma from the medical system, from being dismissed by their physicians, from not being believed. And that's where, you know, the sound healing that Chris and I do comes in. That's where the shamanic work. Last year it was one of the silver linings to COVID-19 was all of a sudden all these classes became available on Zoom. So I got fully certified as a clinical hypnotherapist. So I use a lot of hypnosis for patients who have chronic issues. And yeah, it's been quite a journey.
Yeah, that's a lot going on. I'd love to hear more about a little bit of the sound healing, trance states, the hypnotherapy. Is some of the theory there affecting like delta waves and brain waves. Can you speak a little bit to the? I mean, I'm curious about the physiology of it for sure.
Yeah, well, delta is associated with sleep states. Theta is more meditation, and alpha states are like creativity. And what I'm talking about is the brain waves, like on an EEG, an electroencephalogram. If you put a bunch of wires on your head and they see what's going on in your brain. And a lot of our patients, especially ones who have been poisoned, who have been exposed to toxins over and over again, they get in this hypervigilant state where their limbic system is just in overdrive, and so everything seems like a foreign object that's going to attack you. So you'll get in the elevator with somebody who has on Tom Ford perfume, and you get this huge mast cell reaction from the chemicals. And this is called multiple chemical sensitivity. But really, your olfactory bulb goes straight back to your limbic system, and it'll trigger this like limbic system loop where you're in constant flight or fight. And though the only way to break that we found, and we'll have people come in and they're so inflamed, I can't even give them like a vitamin pill or a supplement or something that is naturally occurring in their body to help them detox stuff out, because they're so hypervigilant. And it's not their fault. It's truly at a deep like reptilian level of the brain. And that's where these sound healing and trance states come in, because it allows you to change your brain wavelength and go into another state where there's new possibilities to make different neural connections and go down a different neural pathway when you encounter somebody's perfume.
Mm-hmm.
Would you explain it in another way, Chris? He does way more sound healing than me. I'm more like the hypnosis lady. But
I think thinking of it as an autonomic nervous system reset is a good way to kind of generalize it from a physiology standpoint. The acutonic system that we use is based on principles of Chinese medicine. So we'll take tuning forks. We also use bowls and gongs and chimes and different sorts of instruments over the body. But we'll actually take the tuning forks and place them on to acupuncture points. So you're activating the acupuncture point with sound frequencies.
And this is where the vibration gets back to the piezoelectric effect and resetting, the electromagnetic fields of the body. So
it's kind of like doing acupuncture without needles in a kind of way. All of the forks that we use too have their own characteristics. So like they're based on planetary archetypes. So, depending on what sort of response you'd like to see or what sort of intention you want to put behind your treatment, you'll select different forks based on that.
And the people who developed the system, one of the ladies, Ellen Franklin, she has a PhD in Jungian psychology. So it taps into archetypes. For example, Mars was the god of war. And so if you have a chronic stealth infection, you might want to stimulate your immune system to wage war. And, you might want to invoke some of that cosmic fire in action, which Mars represents. And what's fascinating about it, Bo, is even if you don't discuss the archetype with the patient, just hearing the sound taps into the collective unconscious and triggers the reaction.
So what people will experience during an acutonics treatment is usually akin to a state of deep meditation. Most people will say like, wow, I was really kind of out for a while there, wasn't I? Some people, it's not quite sleep. Like it's like that state that's like right before sleep, that really when you can tell. And a lot of folks that we do this for they're not meditators. They're not familiar with doing meditation. Some of them say they can't meditate. Like I try to sit down and either like they can't sit still, they can't calm their thoughts, they don't like to do it.
Or they tried an app or
they don't like it or whatever, for whatever reason. But I'm like, well, no problem. If you lay down on the table and I can put some forks around you and some chimes, trust me, you're going to get into a very nice deep meditative state.
Oh, and the crystals.
And the crystals too. Yeah, of course we use crystals. The crystals help a lot. And all these other sort of things that we do along with it from an energetic standpoint. So it can be very powerful as far as, shifting people's physiology, like through the nervous system and through those deep meditative states, and it's in a place where people are guided and supported. I mean, I'm all for, like, we meditate, pretty much every day.
Yeah, we do 20 to 30 minutes every morning,
at
like
least,
clockwork.
And usually we do a nighttime, and then sometimes, we have other special things we like to meditate. Oh, it's a full moon meditation time, right?
Or if I just had a difficult day at work, I have trouble being nice to people if I don't get meditation in.
Exactly.
Yeah.
But even folks who haven't done those sort of practices, they can get a lot of the same benefits through a system like this. And a lot of times, though, it's a portal to open that world to them, so that they can say, oh, now I kind of understand what this is. I can see how this works, and it reinforces all of those things too.
Yeah, for me, I mean, in my practice, I think it's interesting, again, to combine the West and the East, if we're going to call it that, is I just talk about breathing and deep belly breathing. And again, what I talk about, I do a virtual assessment just like this. I'm not going to call you guys out on it, but if you take a deep breath in, 99 out of 100 people are breathing.
Yeah, it's true.
Up here. And ironically, again, for me, this is a thing that, again, there's like this physiology, understanding, whatever. And even our football coach in high school, who was also a chorus instructor, and performers tend to know this, to breathe into the belly. And if you can really engage your diaphragm and things like that you're going to be more powerful there. But at the same time, everybody who's got this anxiety and is up here in this fight or flight constantly, and I can get you to, and there's massaging of the vagus nerve, which is connected to the brain and is calming down for the listeners. I know you guys know all this stuff, but and then when we're getting down into that belly, we're going into that rest and digest. So again, for me, I always speak to the fact that I struggle meditating, however we want to think of it. And it's just that breathing practice of taking those deep belly breaths is completely lowering your nervous system. And it was very interesting, again, because my wife's a very anxious person, and she's one of the, I can never nap people. And she's definitely, we saw it on the Whoop also, because we both got the Whoop, and it tracks your heart rate throughout the day. Mm-hmm. And like, we would do the same exact thing, and her like heart rate's huge. Like, and again, it's this crazy spike, and it's just anxiety that she has, versus I'm over here like, cool, I just took a breath and like, I'm okay. And you can see the results right there on the Whoop. It's pretty fascinating stuff. So I love kind of that blend of it all. And then the other one I wanted to ask you guys about, we just had our these lovely fires here that we barely escaped here in Colorado a few weeks ago. And so there's ash in the air. Everybody on the Facebook groups is wondering, is there like, is this going to be leading to cancer down the line and things like that? I mean, because houses burned and there was a lot of carcinogens that we are probably familiar with, that people live with, and then to have that burned and get up into the atmosphere and then spread out. Apparently they've done a lot of the testing. The water we have here still is a little stinky, just running through the tap. And they've, again, tested it. They say there's nothing coming up negative on testing, but I wonder, again, maybe you can speak to a little bit. And I'm not going to show this to my wife, and she's probably not going to watch this whole thing yet, but she's very, again, anxious about the whole thing, and maybe rightfully so.
Understandably so. I mean, if you're breathing in burnt plastic, it's not good for your health. But sadly, we live in, we get exposed to so many toxins, all of us. And some of our sickest patients have been firefighters, who get, but I mean, they're chronically exposed all the time. Imagine if that's what you do for a living. Yeah. Also, too, they have had issues with, mold toxicity at some of the firehouses and stuff like that. So that adds to it. But yeah, I think that we should all be concerned about toxins, not just people who are experiencing fires, but there's direct toxins that we're exposed to all the time. Our oceans are poisoned now. I was trying to be healthy for years, so all I ate was fish. I had one of the highest mercury levels I've ever seen because of that. And I'm still working on getting that out of my body. It's a huge problem. And I mean, people ask me all the time, I don't know what to eat, what's safe and what isn't. And it's a complicated question.
To me, it's just, everyone needs to do some level of ongoing detoxification procedure. The idea that you're going to do a 2-week detox and
get out 45 years of
fine,
toxins.
and I don't have to do this again for a year or two is really the wrong way to look at it. And a lot of people will do like these. I'm sure you've seen.
Oh, we laugh
of
about
these
Whole
things.
30, like
Whole
what
30.
30
No, dude,
days?
Whole 365 is what you need. Like every day, like you got to eat. You need to eat good food.
And the thing with the Whole 30, I've seen a lot of gyms implement that. And day 31, you're probably undoing the 30 days you just, because it's like, we made it.
It's a good program, but
it's a good idea.
But if you're scarfing Papa John's on day 31 or whatever, there's stuff worse than Papa John's.
But what I was going to say about those detox protocols is some of them are indeed very, very astringent. They're they can be very rough, and they can be real extreme. Some people will tolerate that just fine. Other people won't even tolerate those things for a day or two. So what you do for, supporting your body's ability to detoxify kind of depends on the individual. There's some good general things folks can do to help themselves, like, make sure your water's clean. And if it's not, get water that is, preferably through filtering, actually is better than trying to buy it. And, there's basic supplementation. I mean, we're huge fans of IV therapies. I mean, we do vitamin IVs and IV glutathione and, of course, ozone therapies and stuff like that, on some sort of a maintenance basis. That those sort of things, I think, really make a difference for people. And, I think that's part of the key to healthy aging or healthier aging is that you keep giving your body the help it needs to move things through.
Yeah. Sadly, our generation has the highest toxic burden ever seen.
And this is also the first generation of children coming up that is going to have a shorter life expectancy than the previous generation. The first time that's ever happened in history.
I can't even tell you how many clients we have come in who are in their 20s and 30s with
20s
cancer.
and 30s, and they're developing diseases that are not supposed to happen until you're 50.
And we didn't see this in med school. And I graduated 2004 from medical school, Chris in 2001. And the shift in the last 20 years is incredible.
It's huge.
Do you guys say the number one thing there is just environmental, like food production? Is it
never one thing?
A combination of everything.
It's really a genetic predisposition, like you're a slow detoxifier or a COMT gene or MTHFR, toxic accumulation, standard American diet is a huge problem.
Sad.
Yeah.
Yes.
And then
diet.
Stress levels.
Yeah.
Yeah.
And then the other thing that we see a ton of people with autoimmune disease, and they're put on a blah 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 imab, and these immune modulators. And if you go to the website for the medication, the number one side effect is cancer, because when you suppress your immune system. And so, I'm not against somebody treating their autoimmune disease, but you really need to do a risk-benefit analysis and look at stuff. And so, and then the deeper question is, why is everybody getting autoimmune disease? And I think a lot of it's those root cause reasons. But these are very knotted and tangled and meshed situations. And there's not an easy answer. It's not like, everybody needs to stop eating sugar, and if you do that, you're never going to get cancer.
Well, that's what they tried to do with the low fat, situation, and there's all the fun stories there. But I mean, for me, it goes back to the 5 basics of our humanity, of health, is movement. We're not moving, that's a huge change. There's the recovery component. We're talking about sleep and everything like that. The third one being the nutrition, what we're putting into our bodies. The fourth one being the last two for me are in the mental space of, again, our mindset in general, including some of the stress and things like that. And then the last one is connection. And that's been a huge thing that we've seen during this lockdown of just, it's just a much less connected world, even though we're more connected on the internet now. And we're able to do things like this, but just most people's lives are just not.
And then I would add, number 6 for me would be toxic burden.
Well, that's kind of in that nutrition almost, but in a negative way.
Oh, okay, I see. Yeah,
within my system, but for sure.
It's the anti-nutrition.
Exactly, anti-nutrients.
I've heard people use that term, anti-nutrients. So
well, they say that about is it the grain on brown rice?
Stuff like that.
and lectins.
Mercury is kind of an anti-nutrient too. It's
well, because it takes up space and then it blocks absorption and yeah.
Unless you're a cultivated Taoist, in which case cinnabar.
We use cinnabar, but yeah, I wouldn't go
leads
there.
to immortality, but very few are that cultivated.
I did want to ask, you mentioned IV therapy, and I asked you about this on, I think, Messenger before, but you guys include NAD, and that's, I've played around with that myself. I'm just curious, and again, David Sinclair talks a lot about this, so he is a big supporter of, and I've dove into a bit of the research on this myself, just out of curiosity, but what I've seen is it's actually better to get the precursors NMN and NR rather than putting NAD, because NAD is a very large compound from my understanding, and I'd love to hear your guys' take on this. So I'm just curious what your take on NAD is in general. I know you're fans of it and the IV component. I've seen a lot of positive results. Mm-hmm. I know when I've had it injected personally, like it instantly improves my like peripheral vision and things like that. But I'm just wondering again, for the long term, those levels, is there something about the NMN NR precursors there?
Well, I think NAD, I kind of look at NAD as like the icing on the cake, sprinkles on the sundae, like if we want to use that sort of an analogy. It's not a foundational thing, and neither are the precursors, because really like a lot of the other precursors of what you're trying to accomplish from NAD you can get from other sources that are not so complicated and not so expensive. So I love to use it. And the other thing about NAD especially, well, there's two ways we look at it, really. One is, am I trying to treat someone who's well that wants to be better? Like, am I doing this for wellness? Those sort of folks, you can come in, they can get loaded up with NAD, 3 big doses in a week, and they're going to feel amazing. They're going to love it. Or do I have someone who's chronically ill? If I try to give them a dose of NAD, they might actually crash. They might feel a whole lot worse.
Yeah, I was only able to do NAD for myself after I treated the chronic infections, the other stuff. And then I actually really benefited a lot from the NAD. It really addressed the fatigue. But until you address like chronic Epstein-Barr, chronic cytomegalovirus, the Lyme, we see a ton of people walking around with chronic mycoplasma. And if those are still banging around, the NAD,
it doesn't work. It's like painting. Like
you feel better for about 2 days, and then you crash again.
So it's just the wrong timing. So you're going to get more benefit out of it treating someone who's already on the road to wellness. That's not to say that for someone with chronic illness, it's not a great idea. It's just you have to time it right, and you have to say, well, yeah, you know what? I think NAD is going to be great to help do some mitochondrial rehab for you later.
And you have to get them out of cell danger response, because if they're in cell danger response is I don't know if you're familiar with it, but it's very similar to like a limbic system type of thing. It's when your cells literally feel like the environment is toxic, and so they'll play dead. And this is like the molecular basis for things like chronic fatigue syndrome, and often it's mediated by chronic viral stuff, chronic infections, or toxins. And so your mitochondria will literally go into a quiescent phase, and if you stimulate the mitochondria with NAD, they'll wake up and then they'll be like, oh crap, it's not safe here, and they'll literally shut down even worse. So timing of the NAD is actually quite important with our chronically ill patients.
Makes sense. And Chris, you mentioned ozone therapy. You mind just telling everyone a little bit about what that is and when that might be used?
Sure. So my favorite application of ozone is blood ozonation or major autohemotherapy. It's when we site an IV line, we draw your blood into a jar. The system I use is a closed system. It's a single-use jar, and then we put ozone gas into the jar with your blood. Ozone is O3, oxygen is O2. So ozone rapidly dissociates into oxygen and a free O2 and a free oxygen molecule. And that actually generates a reaction in the blood, which stimulates your mitochondria to improve their function in a lot of different ways. It's also directly virucidal and bactericidal. So like it kills circulating virus and bacteria. The long and the short of it is it really stimulates your body's ability to produce ATP. So like you produce more ATP, your energy levels get better, your detox systems get better. It also neutralizes a lot of inflammatory mediators in the system, that O3 to O2 reaction. So any inflammatory response you have, it goes from being like a negative inflammatory response to the more positive side of inflammation. And like I said, that's like 3 or 4 book chapters into a single sentence. It's not, there's a lot of science behind it. But we use it to treat, the thing I love the most about ozone is because it's basically treating your mitochondria and it's in treating the immune system. It's like a shotgun. It treats like a laundry list of complaints, problems, issues, from chronic infections to cancer to chronic pain. It's very useful for people with particularly with like the Lyme patients, mycotoxin patients, stuff like that. And also for people just looking to maintain their health, like, who are looking for wellness. It improves your blood's oxygen carrying capacity. Like it causes a reaction that's a little similar to training at altitude. So like you actually get a bump in your O2 carrying capacity and people will notice a bump in their cardio with it. But it's something that we like to use, we do it every day, at least a couple of times. I have a couple of patients every day. And it's very safe. Like I said, it's just oxygen. And most people do great with it. So it's one of the therapies that we employ quite regularly in our practice.
Awesome. And then I wanted to make sure we touched on the T-cell testing for chronic infections because you included that.
Yeah. So, that's one of the ways that we diagnose the infections. Like antibody testing is the traditional way we look for infections. But the trouble with the stealth infections, and so we're putting a whole category here of like all the Borrelias, the things like Bartonella, Babesia, Rickettsia, they'll impair your body's immune system to secrete antibodies, so the tests won't turn positive. But when you do T-cell reactions, you can actually expose the T-cells to these individual bugs and then watch and see if the T-cells react. And if there's an active or some level of infectious agent still around, the T-cells will always react.
The other thing is the antibodies. Let's say you had a Lyme when you were 15 at summer camp, it was immediately treated with doxycycline. Those antibodies that you have could be from that prior exposure, even though you don't have an active infection. Whereas the T-cell reactivity test will actually show if the infection is active or not just an old antibody exposure.
So that's
what part of why we find it to be clinically superior, because it actually tells us what's going on in the body right now.
It's so hard with patients who've had chronic Lyme because their symptoms are so all over the place, literally. Like you have it in all parts of your body. They're not necessarily specific. They could be 5 or 10 different sources for it. So we want to know, okay, is this because you have some sort of active infection going on, or is it, results of the inflammatory damage afterwards? Because then the approach to how you actually treat it is very different. If you have something that's an active infection versus, okay, no, it doesn't appear to be active, we're not going to be trying to kill bugs here. And the other thing, of course, is viruses, because we can check for viral infections that way too. Things like Epstein-Barr, CMV, HHV6, HSV1 and 2. And if you don't address viral problems, people
sometimes the virus stuff is the worst.
Viruses are sometimes the worst than the bacteria.
Yeah,
and make people feel really bad.
I can't even.
We're not going to talk about the big virus going on. Right
no. Like chronic Epstein-Barr,
stuff, CMV, all those guys. Yeah, the viral stuff is trickier sometimes than the bacterial stuff, especially if you don't diagnose it properly.
So let's wrap this up on some positive notes, because there's a lot of negative out there for sure, and it's all necessary. But so I'm going to try to wrap it up to my summation. What I've learned here from you guys today is bringing it back, and again reinforcing a lot of the things I think I talk about in a lot of these podcasts is it all comes back to a little bit of chicken egg. Is everybody should get tested by a higher level of testing that we're talking about here in functional medicine, if we're going to label it that. I don't know if you guys have actually seen this. This is a bit of a negative thing that I do want to go into is, have you seen, I've seen a lot of people use the term functional medicine because it's not very well regulated and maybe not have the level of education that you guys are putting together with this.
Yeah. We see that a lot, like people, practitioners ordering tests that they don't know how to interpret.
Right.
And also, like, if you don't know how to treat something, you probably shouldn't order the test.
The lab.
And not to say that it's not possible to learn those things, but I think you should have the education an understanding before you start applying it clinically.
Yeah, or the other one we see is, I saw this functional medicine doctor and then nothing happened. It's like, and you look at what they've done, and it's like,
I get that all the time with acupuncture too.
Yeah,
they're like, I did acupuncture, it didn't work. I'm like,
if you go to their office and they do the same 5 fancy tests on every patient that walks in the door.
I'm sure it's the same with you in physical therapy.
I was going to say the exact same thing. And our analogy that we've used in the physical therapy space is, it's like saying you've gone to McDonald's and all restaurants are not great. It's like, well, I'm a 3-star Michelin restaurant over here. Like, they say they failed with physical therapy, and that was hot packs, electric stim, and a little bit of hands-on maybe. But yeah, that definitely is a thing. But yeah, I was surprised when I was in Southern California. I definitely wanted to connect with functional medicine practitioners in Orange County specifically. And if they're all listening, good for them. I appreciate them listening, but I doubt they are. But a lot of them were chiropractors. There were very few functional medicine doctors. I even went on the the functional medicine registry from IFM, the Institute of Functional Medicine, and then Chris Kresser had a registry, and I looked really hard, and again, the only ones that I could find were these chiropractors who were selling mitochondria supplements, and I was just like, this is not the thing.
And this is where regulation has a good and bad side. I think there needs to be standards for stuff, but then if we were practicing in New York, because it's so tightly regulated, a lot of the stuff we do, it would not be an option. So, I mean, it's like anything. There's good and bad, plus and minuses. So, but yeah, I mean, there's tons of competent practitioners out there, though.
Yeah, and I think at the end of the day, getting some version of testing outside of the traditional medical system is probably going to serve folks well.
Functional medicine is fantastic, but when I completed my IFM certification, I was like, well, they don't acknowledge mold toxicity, and they don't really deal with chronic Lyme. So you're missing a lot of the patients who are actually going to be driven to a functional medicine office. And here's the truth. There's always more of us, more we can learn. We can always become, like you said, 1% better every day. And I mean, this is what pushes me to learn more and strive to become a better practitioner, because I know there's more knowledge and wisdom out there that I try to access. And, last year I spent 1/3 of my income on education.
Mm-hmm. Yeah. I get scared every time I do an audit of how much I've spent on education.
Worth every penny.
I just say it's about $500,000, and that might be accurate or not over my lifetime. I mean, yeah, my doctorate degree alone was over $100,000, and I've taken a lot of continuing education as well. So I definitely understand that. And yeah, lifelong learners, and there's certain books that you can get for $10-15 that might teach you more than certain degrees or certifications will ever teach you. So for sure. The other one I wanted to leave folks with, though, big takeaway is things that anyone can do today, finishing listening to this. If you're not doing, I like the term basic lifestyle guidelines. I don't know if you guys have a similar kind of checklist or anything like that, but again, just setting your circadian rhythms, minimizing toxins. And again, that's a whole chapters of books that we're talking about here. But I don't want to dive too far down the basic lifestyle guidelines, but yeah, improve your sleep, improve what you're putting into your body, start moving more in different ways, really basic stuff that most of us just fail to do. And if you do more of those things, they're the not sexy things, but I think those are the things that will, when you get, something like Lyme in front of your face, if you're more resilient as a human being, and you have these things in place, you're going to be able to handle that better, and B, possibly not be as affected by it. So, I don't want to downplay the effects of something like Lyme for sure, but I do think that at the end of the day, that's my goal as a relatively healthy human being, minus my finger, New York finger. Other than that, that's one of my goals, is to, similar to I mentioned David Sinclair earlier, live to 120, very, very active and alive, and improve the quality of my years, not just the years that I have on this earth. But yeah, I think that those basic lifestyle guidelines for me are just go far and away. And that's the 1% better concept that you just brought up, is these little things add up exponentially if we stay consistent with them. So that's where things like that really add up. So I don't know if you guys have any other major thoughts. I want to be respectful of your time. We're coming up on an hour here. But yeah, any other major concluding thoughts?
I think we covered a lot of ground today.
We did. I'm proud of us.
I actually have a thought, and I've been doing this lately, and my client actually says he does it, and he's one of the most successful and lovely people I know. I have a little journal that I started, and I write down things that I want to manifest right before I go to sleep and dream at night. And, dreaming is a creativity state. So it's a way to work on that manifestation. And it's so simple, but the actual act of writing something down turns those words into a physical reality. And it's something simple, but I started writing lists of stuff that I intend to manifest.
Awesome. Yeah, I love that. We use the 5-minute journal, which is a little bit of a gratitude practice, and you write down kind of a reflection from the day and what could have gone better today, and then you write in the morning as well of what needs to happen for the day or what can happen for the day. So it gives you that opportunity. Same thing. Yeah, that's what we utilize, but I like that concept you're talking about for sure. My dog really wants to manifest this ball, so you guys talk for a second. I'm gonna grab this ball. Sorry.
No, that's okay.
Yeah.
And the other thing that I tell this to people all the time, and they rarely take my advice, but when I have patients who truly can't sleep and their circadian rhythm is wonkadoodle, I will tell them to go camping, because, when you go camping, if you're truly sleeping in a tent on the ground, as soon as the sun comes up, you're awake. Even if you stayed up till 3 a.m. the night before getting drunk by the campfire. And there's something about being in close sync with nature and the sunrise that helps you reestablish the correct adrenal cortisol rhythms.
And I'm going to say this fun fact that I've been studying circadian rhythms for well over a decade myself now. And I worked with a sleep system company, Reverie. And it took me a very long time to discover the root of the word circadian, which is circadian, which is approximately a day. And I was like, oh, that makes a lot of sense. And it really helped me kind of connect those dots of like, yeah, at the end of the day, circadian rhythm, you're trying to simulate a 24-hour sunrise, sunset cycle and rock with that. And so, yeah, we all tend to stay up much later than we should. And again, the concept of blue light blocking glasses is something that's out there. And now it's kind of like, there's a lot more to it than that. I don't know. Also, another name I'll throw out there. You guys follow Andrew Huberman at all? He's
no, we got stuff to learn from you.
Yeah,
Bo knows.
That's
so
right.
Thank you for making me a little better.
Yeah, he's he studies. I think I forget. I'm gonna mess up his title. I always mess it up. I think he's not a biochemist, but he studies a lot of ophthalmological science and basically how light into the eyes affects all your hormones. And again, he's one that kind of poo-poos the concept of blue light blocking versus there's 1,000 other things going on. And again, there's just the importance of getting out and getting sunlight as much as possible, even through gray skies, first thing in the morning, and just that'll set your circadian rhythms in a lot of ways. But yeah, he's a really interesting guy that I'll just touch base on, and he's been recently just gaining a lot of traction, I think, with his podcast and things like that, and some of the stuff he's putting out there. But very interesting concepts and very evidence-based guy. That's just he's super interesting. I would definitely recommend him. I can share some episodes when we're done here with you guys.
All
right.
Thank you so much, Bo. I really appreciate inviting us onto your podcast.
Thanks for having us.
Thank you guys for being on. And before we go, tell folks where they can get a hold of you guys, and if they want to follow up.
Well, our website is www.miamibeachcwc.com. And that's probably the best way to get a hold of us is via the website.
Awesome. I put that in the comments here, and then that'll be up on the screen. There it is. Yeah, I think I spelled it right.
Yeah, perfect.
Yes. Well, thank you guys. You could stay on. We're going to end the broadcast, but yes, thank you guys. Hope you got 1% better today. If you checked us out, don't forget to share, like, subscribe, leave a comment, leave a rating, leave a review, all the things, and we'll see y'all next time.